Musculoskeletal and genitourinary, starting with musculoskeletal. Tendons connect muscle to bone. Ligaments connect bone to bone. Bone remodeling is influenced by nutrition. Parathyroid hormone is from the parathyroid. Controls calcium, it releases calcium. Calcitonin puts calcium back in the bone for storage. It comes from the thyroid, like the T3 and T4. When released, calcitonin reduces serum calcium. They both work together for homeostasis. Human growth hormone stimulates growth in children. It comes from the anterior pituitary gland. It stimulates the epiphyseal plates to grow. Too much, you get gigantism, which is more than 7 foot tall. Too little, you get dwarfism, which is 4 foot 10 or less. Estrogen will cause closure of the epiphyseal plates. It limits bone reabsorption, and changes in menopause can cause height to go down and osteoporosis increase. Bone mass can be helped with weight-bearing exercises such as walking, resistance stretching, and swimming, which is the best. Muscles and stretching. Excitability means responding to stimuli, such as electromyography. Contractibility is being worked, shortening and contracting. Extensibility has to do with stretching and flexible abilities. Elasticity means muscles should return to their original length after stretching. And again, tendons connect muscle to bone, ligaments connect bone to bone. Loss of muscle tone is atrophy. The deep tendon reflexes can be tested, such as when you hit your knee with a hammer. Spasticity is usually referring to cerebral palsy, Parkinson's, and multiple sclerosis. They have no control over their muscles. Stretching improves range of movement and flexibility. Muscle tone improves posture. Restless legs can be from neurological or spasticity. DEXA scan, which is dual X-ray absorptiometry. It checks for osteoporosis, which is porous bones that will break easily. Often, a patient will break a bone and then fall. Calcium and weight-bearing exercises can help. Calcium can be from diet or from supplements. Smoking and sedentary lifestyle are risks for osteoporosis. A person in their 20s to 40s, you should prepare them and prevent osteoporosis. So by doing things like weight-bearing exercises or making sure you have enough calcium and stopping smoking and not having a sedentary lifestyle. Medications are alendronates and other dronates, but they have a problem of esophagitis as a side effect and jaw necrosis. The patient must sit upright 30 minutes or more after medication. Low back pain could be a herniated disc, which a herniated nerve root leads to sharp pain or neuropathy. It could also be osteoarthritis, spinal stenosis, which are both mechanical. Turning wrong can be debilitating for this type of problem. You can help them by stretching them or strengthening proper body mechanics, which is ergonomics. Prevent with good nutrition and good mattress or pillow support. Loss of bowel and bladder. Weak legs are cause for concern because it's possible herniation. The meds you can try are NSAIDs, but contraindicated with kidney issues. Take with food as it can cause a GI upset and it can cause hypertension. Immobility and systemic effects. The immobility also affects cardiovascular. They're at risk for DVT. Also, atelectasis is alveoli collapse, so a patient is at risk for this, and also pressure sores and constipation. You can reposition them and hydrate adequately. Reposition every 2 hours, and the urine output needs to be at least 30 mils per hour, but really it should be more than that. So also watch fluid volume overload with COPD people. The patient should get up and ambulate. You can use a PT for a PRN consult, and you can try an incentives barometer. Chronic immobility. The patient will likely experience depression and anxiety from loss of independence and decreased self-worth. You can help patient with the passive ROM, assess and turn every 2 hours, encourage patient to do physical therapy, have a nutrition consult, and increase hydration, but obviously INOs are important. Safety and immobility issues. You should use gait belts, a walker, crutches, whatever you need to help them get around. Transfer techniques should be ergonomical. The BMAT, which is the bedside mobility assessment tool, you can use that to assess the patient mobility needs, and physical therapy can do a consult. The patient should be on full prevention. Non-skid socks, bed alarm, call light left within reach. Assess the neurovascular status, which is pain, pallor, paralysis, pulselessness, poikilothermia, and paresthesia. Amputations. They can be planned or traumatic. Post-op, the most important thing to address is bleeding. It can sometimes be reattached, but obviously not from a chronic disease. They will amputate up to the healthy part. Lower limb amputations, the patient should frequently lie prone to prevent contractures, and they will need psychological support. Pain control is so important, especially with phantom limb pain. You can give them gabapentin, which is Neurontin, or SSRIs, a PCA pump post-op, and opioids for general pain, and amputations are performed for non-viable tissue. The wound care nurse will need to monitor the stump for signs and symptoms of infection, prepare them for prosthetics, educate patient with assistive devices. Skeletal traction and Buck's skin traction. Skin integrity is the most important thing to address. Do not touch the traction and the weight. Let it touch don't ever let it touch the floor. Skeletal will be pins and rods into the bone. Infection is very important to prevent. It's done with surgery. Buck's skin traction is a wrapped ace bandage attached to weights and a pulley system. Non-invasive, but it can break down skin and cause circulation problems. Pain is what the patient says it is. Fractures. In the field, splinter where it lies. A comminuted fracture, is crushed. There's lots of fragments. A transverse is straight across. Oblique is a diagonal angle across. An impacted is crushed into itself. A spiral is torqued, indication of possible child abuse. And green stick is not fully broken, often with kids due to their flexible bones. Fractures again. Hip fractures will present with external rotation of one leg shorter than the other and pain. Open fracture, you can see the bone coming out of the skin opening. You will see bruising, swelling, deformity, and loss of function. You can diagnose this with an X-ray or an MRI, monitor for the infection. Long bone fractures can cause fatty embolism. Compartment syndrome requires a fasciotomy. Arthritis, osteoarthritis, and rheumatoid arthritis is inflammation of a joint. They can have NSAIDs for medication and joint protection. Treatment is eventual. They may need a hip or a knee replacement, and they can use assistive devices. Now, about bone tissues and cells. The cortical bone is dense for strength. The cancellous bone is spongy, and it makes marrow. Red bone marrow makes blood cells. Yellow bone marrow makes fat. Osteoblast is referring to building. Osteoclast is for destroying. Osteocyte is for maintaining. Muscle relaxants are used for spasms. Baclofen is often given to multiple sclerosis patients, but if you're discontinuing that medication, it needs to be tapered off. Avoid alcohol with all muscle relaxants. And allopurinol is for anti-gout. Hydration is important. Avoid purines and monitor for uric acid. Genitourinary. The nephron is the functional unit of the kidneys. We have millions of nephrons. We don't just have 16. Nephrons are where the blood and urine meet. The loop of Henle is where the loop diuretics work. The glomerular filtration rate tells how well the glomerulus are working. And the glomerulus is located at the top of the Bowman's capsule. Part of the filtration as it goes through the kidneys. The first part is filtration, and blood pressure will affect this. The second part is reabsorption, which is when it puts back electrolytes and whatever else it needs to back into the blood. The third part is secretion. It places unwanted things into the urine. And the fourth part is excretion, which means the body will eliminate this outside of the body. Blood and urine meet in the nephrons, and this is the functional unit of the kidneys. And the function of the glomerulus in the Bowman's capsule is filtration, and it enters with the pressure of the blood pressure. Healthy kidneys will be able to separate wanted and unwanted filtrates, and the glomerular filtration rate is the kidney's ability to filter out, so less urine output means it's decreased. It shows the kidney function and the volume status. The BUN and creatinine can be looked at also. Hemodialysis and peritoneal dialysis refers to blood for hemodialysis and peritoneal cavity fluid for peritoneal dialysis. Both are for filtering because the kidneys have failed. Hyperkalemia is a big problem. With hemodialysis, the patient will have an access port, and the port will have a thrill or a buoy. You need to evaluate INOs, vitals, and blood pressure, and the blood pressure will decrease if the dialysis is too fast, so they have too much output. The heart rate will be up due to stress, and look for signs and symptoms of depression and infection. Complications of dialysis. They can have weight changes or infection. Check for bleeding at the site because we use a large gauge needle. Muscle cramping due to hypokalemia. And cloudy effluent will be abnormal. Renal calculi. It forms in the renal papillae. It's caused by dehydration from high calcium. The signs and symptoms are pain, stones in urine, possibly zero urine output or hematuria, flank pain, dark urine, nausea. You should give them fluids. Address the pain. You could use Dilaudid, but NSAIDs first. You can try opioids as well. Lithotripsy is an option to remove the stones, and allopurinol can be used if it's a uric acid stone, and thiazides for calcium stones. Worsening glomerulonephritis will be indicated with a BUN up and creatinine up and the glomerular filtration down. Red blood cells and protein in urine will be indicators of this as well, and nephrotic syndrome can occur. The treatment is get the hypertension down with antihypertensives, fluid and sodium restrictions, monitor the BUN, creatinine, and GFR. Polycystic kidney disease. This is a genetic inherited mutation that causes cysts in the nephrons. The blood pressure will be up. They'll have flank pain, dark oliguria, hematuria, large kidneys. Renal failure can happen. You should monitor the blood pressure for hypertension. Hydrate carefully and avoid nephrotic meds. Pyelonephritis usually happens if a patient is in contact with E. coli and ascending UTIs. The hallmark signs are flank pain, costovertebral angle pain, tenderness, nausea, and dysuria. Diagnosed with a UA, you can use antibiotics such as ciprofloxacin and levofloxacin, and Bactrim if it is resistant to the others. Benign prostatic hyperplasia. The signs and symptoms will be hesitancy, a weak stream, urgency, nocturia, and incomplete bladder emptying. TURP can be performed to open up urethra to make room for the urine excretion, and CBI, continuous bladder irrigation, will be post-op after the TURP to keep the flow steady. Watch for clots, urine output monitoring, excessive bleeding and pain, and bladder spasms. Retention and incontinence. You can diagnose this with a bladder scan. It's possibly caused by benign prostatic hyperplasia. You can use anticholinergic drugs which will dry you up. The cause is sometimes also the neurogenic bladder. Stress incontinence is from coughing and sneezing. Functional incontinence means you can't get to the bathroom fast enough. The other types of incontinence are urge, overflow, and reflex. You can try bladder training, Kegels, pelvic floor exercises, incontinence pads, and anticholinergic drugs. Fluid volume overload threatens breathing and increases hypertension. Physical should be prioritized over emotional problems, and these following symptoms are important to report to the healthcare provider immediately. That is anuria, hyperkalemia, fluid volume overload, hypertension, confusion, and level of consciousness changes. And that's everything I have for musculoskeletal system, and genitourinary. And these notes were taken by me from lecture, and this video was made for me, by me, so I can try and understand these topics. Thank you.